This is Dr. Phyllis Edwards, Dr. E, welcoming you to The Widows Speak. This is actually our 6th podcast. I'm very proud of it and very thankful to Flagler Voice for doing this and hosting this. I am a recent widow, and as I've been trudging through this life so far, I found a lot of things that I feel other people need to know, and I'm trying to find a way, and these people were so gracious to help me to reach as many people as possible, because I want folks to know that you're not alone, that the things that you're experiencing are normal. They will be different for you and different for me. And if you found us, that's good. We are on Spotify, we're on YouTube, all your big ones, Facebook. So just look us up and go back and, try to watch some of the episodes. We're now into the expert phase. Thank you, all of you, for hung on there and went through me and talking about the things that I had seen. And now it's time to really gain knowledge from some of these wonderful, wonderful people. Today, we have Rachel Daly. She is a phenomenal healthcare expert, a medical person. We have done the social in the past. We've done the psyche, but she's also going to talk a little bit about that, I have a feeling, because you can't talk about the body without talking about the mind and the emotion and what's going on. She has her own practice. I'm extremely impressed with her. I met her a few years ago. Had to do more with my husband than me. Was really impressed that she actually comes to your house. It's like, for those of you that are my age, maybe you remember Dr. Welby, MD, or something like that, but she will come to your house. She does all kinds of things like blood work, and she does EKGs. And, well, now she actually has a thriving practice. She has her own place to go, or her own business. And I will say, though, if you're going to go, don't take the stairs like I did and then go for an EKG.
We've actually moved.
That was just
we
dumb.
We have no more stairs.
That was just dumb. Straight up the stairs I went and then into an EKG. So, luckily I didn't at that point have the heart attack.
Yeah.
But anyway, Rachel, Dr. Daly, will you please tell us about yourself?
I sure will. So my name's Rachel. I'm a doctorate prepared family nurse practitioner. I'm board certified. I do own the direct primary care practice, Lotus Elite Care, here in town. We're going into our 5th year. We do home visits. We have in-office visits.
You do everything. You do blood work.
We do labs. We do, obviously, primary care. We do hormone replacement therapy, medically managed weight loss. We are diving into peptides. We do a little bit of aesthetics. So we're kind of a one-stop shop.
I love that. I do love that. That's great.
I worked in the ER for 10 years as a nurse practitioner and 6 years in the surgical trauma ICU prior to that. So over the years, I've had a lot of experience with death and dying. Mm-hmm. I am not a grief expert, but I have helped many patients through the process.
Right.
There's a lot of time that I spend with patients going, actively dying and family members, and then the aftermath.
Right.
So thank you for having me.
Thank you for coming. So I'm always curious because, my background is in education. For you to have reached that level, because that is basically one of the highest levels in terms of nursing in your area. What did that take? How many years did that take you to
So I have an undergrad degree. I went to FAU. I got my bachelor's of science in nursing. Mm-hmm. So 4 years of education there. And then when I started my doctoral program at University of Florida, at that time, and still nurse practitioners can be master's prepared.
Right.
So UF had the DNP program. We had the option to stop at the master's level or continue on. So I decided to continue on for my doctorate. So a total of 9 years, only because I went part-time initially because I had a 1-year-old and a 1-month-old.
Which many moms do.
Through the master's portion, and then transitioned to full-time for doctorate.
And what made you decide that you wanted to kind of branch out? So you were in the emergency room for 10 years. I mean, enough to probably pull your hair out. But then you decided to go off and do this. Like, what came to you to?
So the emergency room was an amazing place to be. If you're kind of an adrenaline junkie and things, you see a lot, you learn a lot. But when I decided to go out on my own, I wanted what I was doing to make a difference. And what I learned in the ER is, the ER is abused by many people, not intentionally, but because
they have nowhere to
they
go.
don't have anywhere else to go. They don't have a doc, they can't afford a doc, or their office is closed.
Right.
So I would leave a 7 p.m. shift sometimes and come back at 7 a.m. and somebody was still there waiting for a note or waiting for a sore throat because they weren't an emergency.
Right.
And rightfully so, emergencies go first.
Right.
So my goal was to make healthcare accessible, affordable, and if I send my patients to the ER, they usually need to be there.
Right.
So the foundation of being in the ER has allowed me to be able to have a little bit more of those fine-tuned assessment skills and focused as well to make quicker decisions.
And I love how you basically try to treat the whole person. I think that's one thing that I think is truly missing. It has become very cold in some ways, and you're missing a lot when you don't take into account, the big picture of what this person is like, what this person is going through. So I think that, again, that's to your credit.
Well, thank you.
I know there was a time when my husband came back from one of the trips to the hospital, and he was on oxygen, and we called you, and you came to the house, and I could tell he was upset with that. He was scared. He didn't want to do that. And he told me, I said, I don't want to be on this. I'm going to get off it. And you came over and provided such confidence that really I think you gave him the ability to try to say, maybe I really don't need this. And so I personally want to thank you for that because it really made a huge difference in him at that time, and certainly for us. So we're going to move on. Obviously, it's for everybody really, but I'm trying to speak to widows because widows, we are the caregivers, the first caregivers, lines of defense, if you will. And sometimes we do that for a long, long time, which means we don't take care of ourselves. There's a lot of ourselves that just get kind of pushed off to the side. And then all of a sudden it happens and you are by yourself and you're trying to figure out what you need to do. I have read a bit, and then when I came into your office that day, I was going for something else, but as it turned out, even the time that we had, I want you to talk a little bit about what that kind of, it's stress, it's a depression, it's just a change in your lifestyle that's so huge. You just feel like the underpinnings of your life have been kind of ripped away from you. You're very isolated. You don't talk as much as you used to. Although judging from this, I'm talking too much.
This is the best thing. I'm so proud of you.
But I would like you to talk for a minute about what you see as the physical ramifications, if you will, of some of the things that could happen that maybe those of us that have been, now we're in this position. What should we think about? What should we look for?
I think as, prior to becoming a widow, your whole self is a lot of times invested into caregiving, and you lose a lot of yourself, your identity, who you are, and actually your identity for all of the years you were married is with that person as your husband or your spouse. So when that chapter ends, there's a physiological response. You are stressed, you're not sleeping, inflammation increases because you're not resting, you're not eating well. So I see a lot of times patients of recent loss, they're almost they're almost just a skeleton of themselves, of how they were. And there's a process that they're going through. And the thing about grief and loss is nobody's going to be able to tell you how to do it or what to expect. And your feelings and the stages of grief that you go through are going to vary, and they're going to change day to day. There's no direct path for grief. And as soon as you think you have a handle on it, something can trigger, something can happen, and you feel like you're back at step one. And I think for people in general, women who have recently experienced loss, and even that adjustment over the first year, you have to be able to give yourself grace. You have to be able to find somebody or a group of people who have that common knowing, because if you haven't lived it and you haven't gone through it, you don't understand it. And it is so hard.
It is.
But significant weight loss, deep depression, isolation. A lot of women who have always done their lives with their partner, they've gone out, everything they did together. And now 50 years later, that part of them is gone. So it seems terrifying to go out and try something new and see what that life looks like on your own, or try, doing it without the person who literally was your other half.
Right, exactly.
So isolation leads to further depression. Depression and sadness is normal following loss, but it can get into a very dark place. So as a provider, me knowing you, or knowing a patient, if we can have those hard conversations and know that it is okay to reach out and get help, and maybe situationally take a medication to help you through the hard times. And once life is better, you're adjusting, we can take a step back and see if it's something that we can come off. So there's a big stigma sometimes associated with asking for that help, going on that medication, admitting that I don't really have control of this. Like, I don't even know what to do next. So having a good relationship with your patients and being able to talk about these things can make it easier to work through the process together.
I noticed that just that day I was in where we took the blood, and then later on when you called me about the blood test, you were noticing that, in fact, you hit it right on the head. You said you're not eating. I can tell because I think it was the protein.
Your protein.
Yeah, I don't cook anymore. I haven't cooked in 6 months. I cooked for my husband, and now I don't cook. So I'm big into peanut butter. Talk to a lot of other widows. Peanut butter, English muffins. I mean, it's just stuff like that. Could be a cracker, could be cereal at night, but that protein is not there. And you told me, listen, you were very calm. You said, just add a protein shake or something. I've been trying to do that. I'm going to tell you, I can't get it all down most of the time, but I do try. But I was amazed at how, like, you just looked at a blood test and you're like, I can tell right now that you're not eating properly. And your kids can tell you, you're not eating anymore.
Mom,
and I have lost weight, but I need to lose more. But,
well, we want it to be good weight.
We want it to be good weight. You don't want it to just be like you're losing your muscle tone, you're losing everything. But the other thing that we talked about was the heart attack,
the broken heart syndrome.
The broken heart syndrome. Can you talk about that?
It's not a super common occurrence, but within the first year, more commonly, immediately
3 to 6 months.
Yep, up to 6 months following death, there is something that's called broken heart syndrome, and it's actually death. caused by a heart attack,
It's real.
essentially, that does happen. There's no blockage. There's no organic cause
Reason.
other than the physiological stress, the hormones, the chemicals associated with that, adrenaline rush. It actually physically changes how the heart pumps, and it leads to an acute heart attack, and it leads to death. So the stress response in itself of grieving can wreak havoc overall in the body.
All your functions.
Yep, all of your functions. But the broken heart syndrome is something that does happen. I don't think it's something
To worry
to
about.
fear
Yeah.
or something that we can even control. It is an occurrence that happens that we really can't stop. So, but it is
It's a real
it's
thing.
a real thing.
So other people also have told me, and I have experienced panic attacks. Can you describe, just talk about that for a minute? Because you think you're like going crazy, you're losing it, you know?
And a part of you feels like you absolutely are, but everything is disrupted. You're not sleeping. Your cortisol levels are up. You're excessively stressed. You're adjusting, or even haven't even stepped into the realm of trying to adjust to this new lifestyle. And it's a situation where you are out of control. You have no control over what just happened, and you really have no control over what's going on in your body because of what just happened. So the depression, the not eating, the not sleeping, all exacerbates that. And people can start having increased anxiety, increased panic attacks, the increased heart rate, the breathing, the pressure on your chest, where you feel like you it's almost like impending doom in a sense.
Yes. That's how you feel.
Blood pressure's up. You really, like you said, feel like you're losing it. And it's important for anybody going through that, or even starting to experience, to reach out. Like, we can help you calm yourself down, and it's okay if it's a medication that does it, because if we can get you sleeping and we can get you eating, then you can have the clear mind to start working on this process of healing. And healing is not going to be quick. You have to be realistic about that. But like you've done, I'm super proud of you. You've found something like this to talk through it, but help people at the same time. I think this is a brilliant thing that you've done. Even if one person,
exactly. Or, like I say, if it's a gentleman, it could be your sister, it could be anybody that's going through this. I'm also hoping that we reach people that are in organizations, businesses, community. I'd love to talk to somebody in government. It's amazing. You have to go through all this physiological stuff. You're going through the psychological. The social is really tough. You've been married for 50 years. You haven't gone anywhere really without your husband, except for maybe with a girlfriend to lunch. And then all of a sudden you're walking into a group by yourself.
You don't know anybody.
It's really awkward. Yeah. Nobody wants to sit with you. I mean, it's true. I mean, it does exist.
And people don't know what to say.
No, they don't.
Right? So it's very awkward.
Yeah.
Situation. And I feel like you can be critiqued on every level, or at least you feel that.
You feel that way, and you're probably not.
I don't think most people do, but
yeah.
She's out already. Oh, I haven't seen her in weeks.
One way or another, you can't do the right thing. But I don't think that's as important as trying to get people to understand. I think you mentioned it, isolation. What I'm finding is that a lot of people, they just don't come out of their houses. They just, I personally go, kind of bonkers not coming out, but they don't want to. They do need other people.
Yep.
And
that's part of, that isolation is going to worsen the depression, can worsen the anxiety. And sometimes all it takes is one friend or one person to start coming over to help drag you out of that spot, get you out, go to lunch, and you realize, like, okay, I did this. Or you take yourself for a walk around the block. You don't have to start interacting and trying to explain things to people right away.
Right.
You can start seeing what it feels like to be by yourself and realizing that you are okay. And that strength will come with practice. That's what you're doing. You're practicing being your new person and finding out who you are.
Really,
because
that's
you are
true.
you are becoming a completely different person than you were for the last 50 years.
And you don't even know who you were when you were 21. I mean,
Right.
that's the last time I
Yep.
was I was single, right? So it's like, who was that girl? I look at pictures and I'm thinking, wow, she looks really happy.
And you've been a caregiver.
For a long
you were
time.
a caregiver for a long time.
Yeah.
So now getting the time to say, do I like pottery? Do I like painting? Do I like bird watching? Right? You can try it all.
Yeah.
But it's taking that step to get yourself out of that isolation. And sometimes, like I said, a friend or a family member to drag you out
Right.
can help you to adjust and discover your new you.
And I just think it's really important, or you're not. I just don't know how people will heal. Why do you think there is such, like, I'm one of those people. I don't like to take pills, but why do you think there is such a fear or aversion to actually taking a medication to help you?
I think there's a lot of mixed information. You can find information supporting and going against medication, the same medication that will tell you two different sides. And there's a lot of fear of that. It's something you're going to have to be on, or people don't want to be judged, or do they have a real mental illness? It's okay. You are depressed, and the medication can help you. And not everybody will have the same medication work perfectly for them. And that's another scary part, because there are so many of them. And I tried this before and it made me feel this way.
Yeah.
I tried this before and I was mad all the time. But that's, again, where your relationship with your provider comes
really
into play.
important.
We try it. If it doesn't work, we try something else. You can also, sometimes with medications, especially for depression, you can stoop into a darker hole. So we want to make sure we have that line of communication open when we do start something. And I always start my patients low. And we can titrate up as we go if we need more. But it also takes a little bit of time for those things to work. So we can't write them off day one, because it doesn't make us feel better.
It doesn't immediately go to its level.
Right.
Right. So what else would you recommend? I mean, I've always heard people say exercise if you can, even if it's, like you said, walk around the block,
Yep.
Do
Start
something.
a new routine. Have a daily goal. Sometimes it's getting through this minute, and then hour, and then the day. And along every second of that way, giving yourself grace to maybe I'm not feeling like it right now, right? It's okay for us to try again later, but trying to make sure you eat. Make a very simple routine. Okay, I'm going to eat the granola bar or have the protein shake.
Right.
And then I'm going to walk outside and get the mail. And then I'm going to come in and I'm going to watch Dr. Phil. Whatever it is.
Whatever it is.
A routine for you that can keep you moving step by step towards your next step.
So that's really important. And you can take those baby steps. It doesn't have to be join a gym, but, if you're so inclined, great. You
might get motivated along the way.
You might find something that you like to do. I don't know. Maybe I should take up bodybuilding
You'll be the next Miss Fit.
in my last segment of my life. I don't know. So
I think that's a great goal.
what are some other tips that, like, let's talk about family too, because you see the big picture. I think about the person. You may have grown children, or somebody that's there for you or trying to be there for you. My kids have been great. They've tried really hard, but sometimes they say to me, in fact, just recently, one of them said to me, gosh, we went out to lunch and everything. Now, I thought I did great. I didn't cry or anything. And she said, it's like being with a statue.
Yeah.
Like, I'm thinking, what did I do?
Yeah.
I thought I was doing great. But
So I think one, as a mom, as women, we've always been the strong pillar of our family. We keep things going, we keep things running smooth. And when mom can't do that and mom needs help, people, our children, trying to dive in and surround us and help us can be overwhelming.
yes,
They probably don't know how to help you because you really have never asked.
no.
And
They don't know how, and they don't understand why maybe you're not receiving things the same way.
like, come on, mom.
Yeah.
Like,
What? Get out of it. What are you, a Victorian and a heroine in a Victorian novel? That kind of thing.
and so family is really important. They're going through their own type of grieving. So how they react or deflect may not be intentional, but it's not helpful all the time. So that's where really sometimes having a really good girlfriend, having somebody that you can reach out and just talk it all out with,
Right.
cry it out.
Really helps.
Yeah. And helps. And it will help take those little side comments a little bit easier and don't take it personal.
Crying it out is, I feel like sometimes you just have to cry.
Absolutely.
You got to get it out. Tell us again where your practice is located and
So
what
it's
the name
Lotus
of it
Elite.
is.
Yep, it's Lotus Elite Care. It's a direct primary care practice, and we just moved. We're at 24 Old Kings Road North, Palm Coast 32137.
And that's in the shopping plaza it's a lot now.
Yes, so it's
built
in the
up.
school. It's in the Capstone building. There's Fire and Ice, which has cryo, red light, compression. There's Betsy. She's a physical therapist. She's Excel, sports medicine.
There's a lot there.
And then there's Mission Ready CrossFit. Yep.
And it's right down from Lowe's, if I remember correctly, I think.
Not Lowe's. Lowe's is over where we used to be.
Yeah.
And now we are across the way. We moved since you came.
Yeah.
So 24
Okay.
Old Kings
You moved.
Road North.
Okay.
We're across from the bowling alley
Okay.
in Palm Coast.
Okay. Well, I want to thank everybody for joining us for our 6th episode of The Widows Speak. Remember where you can find us. Please look us up. Under Flagler Voice, go down and you can see new podcasts. And it's, like I said, it's on all the major carriers. So we are going to have other experts in the future, but we're also going to have a time where you guys get to call in and talk to us, give us your comments, ask questions. It's a great way to kind of learn about everything and to share your story. But also, if you're not ready to come out and be a guest, that's fine too. But we're very grateful again to have the time. And I just want to say, as I say every time, that, there is beauty for ashes and that God is with the lonely and the brokenhearted. And please know that prayers are very important, and we think about you, and I hope you'll think about me. And together we'll keep taking these steps to move forward. God bless you. Goodbye.
I love it. Thank you.
Did a great job.